Now, Dr. Hilary Jones is in the Midlands for the opening of a hospital. It's a reopening and it is going to bring a great opportunity for NHS waiting lists to reduce. And he joins me now to tell me more about what's going on. How are you doing, sir?
I'm very well, Jason. How are you?
All good here. So good to talk to you again and good to see you in the Midlands. So, which hospital are you at?
So I'm at the Practice Plus Group Hospital in Somerset Road in Edgbaston, which is just about to officially open today. And I'm really pleased to be here to have a look around and to hear about the fantastic relationship that it will have with NHS patients as well as private healthcare patients. So it's going to be almost a unique mixture of both. So it will be seeing NHS patients, reducing the waiting lists, which are pretty horrendous in this neck of the woods, as you know, in the West Midlands. Something like 500,000 people waiting for a hospital appointment, of whom 20,000 have been waiting more than a year. So they will be able to use the choose and book system and be referred by their healthcare provider, a GP or a physio, to come here as an NHS patient to compare waiting lists. And if people want to go private, as more people are these days, when it's affordable, they can choose to come here as well. So it's a blend of both NHS work and private healthcare work, which is going to help a lot of people in the long run.
So effectively, the NHS buying extra capacity to sustain where people need to be on the treatment scale that they have. And what sort of treatments are they offering? Is it a full general hospital?
The things that most people are craving and where there is most demand are things like orthopedic surgery, hip replacements, knee replacements, some shoulders as well, but also endoscopies. People with upper digestive issues, people with lower digestive issues. Endoscopy is very much in demand and there is a long waiting list. Cataract surgery. So you've got people who are lacking mobility, who are in a lot of pain, who can't sleep. They've got abdominal issues. And unless they're seen quickly, you've got delayed diagnosis, you've got all that quality of life that is being lost. People who can't read properly because of cataract surgery. We need fast access to this kind of surgery. And that's what a hospital like this is going to be able to provide. They're hoping to see at full capacity about 8,000 patients every year. So that'll make a huge dent in the waiting lists in this region.
Absolutely, and so it allows people to be able to have that option as a hospital, which is opening now. Literally, by yourself this afternoon, you're cutting the ribbon and everything. It's got zero waiting list at the moment, and a patient's already lined up to start using the facilities as of say tomorrow.
Yes, they're seeing consultations as we speak. The
Hmm.
theatres will open in a short while, in a few days or weeks. And I've had a tour, and it's state of the art theatres. They've got X-ray suite is fantastic. Smiley staff are very welcoming, and that all makes it different. You want a healing environment. People need to know what they're going to expect when they get to hospital. What they want is efficient care. They want safety. All of these hospitals under this group have got 100% or good or outstanding, good aftercare as well. It's really very impressive. And I think that people who decide to go private can know that they've got fixed prices. They know what they're going to pay. There's going to be no spiraling costs, no hidden extras. And at an affordable cost compared to many other healthcare providers.
So you're looking really at, I say, this hybrid method. And how long has this been in the planning? Do we know?
It's been in the planning quite a while. This is part of a group of 12 hospitals. This is the 12th. So there's plenty of experience amongst the group hospitals elsewhere. And they've refurbished this hospital, which was previously a clinic, but it's now state of the art. Building work is nearly finished. It's looking really good. And as I say, when you come into a clinic for a procedure, you want it to be fresh and clean. You want to be welcomed. You want to know what to expect and know that you're going to get the care that everyone deserves. And I can honestly say that if I was a patient here, I'd be pretty happy indeed coming here.
Well, absolutely, and I say to have seen the facilities, and as a GP, because even though we mostly see you for your TV work, you're still a practicing doctor, and it's knowing that you can then refer your patients on, and they're going to get treated quickly, whether it be a private or an NHS route they take.
Well, that's right. I mean, I've built my career on looking after patients, caring for them, understanding their needs, investigating them, diagnosing, and referring them. And what people need when they get that referral is to know what to expect. And of course, I've been a patient myself. I've been on the receiving end of NHS and private care. And it's so important to know what the expectations are, to be clear about what's going to happen, to understand that it's going to involve some rehab and some physio, possibly after surgery. So all this is important, and it's part of holistic care, which certainly here in this hospital is an essential part of the treatment program.
Well, I mean, it's great to know that these extra facilities are there, that it is going to be available at a no cost at point of use to people when they need it, in addition to the extra private care that they'll be carrying out. So, where can we go for more information and to select this Edgbaston-based hospital when it comes down to getting our own treatment?
If patients are seeing their GP today, they should remember that their healthcare provider, GP or physio or whoever, can give them options, a list of options about choose and book. So if they want to choose a location, if they want to choose a specific hospital, they can see if it's on that list of options, to ask the GP to refer them to that particular place. So that is part of the NHS constitution. It's not something that a lot of people yet know about, but you can do that. And that includes private hospitals like this one, even if you're going to see them as an NHS patient. Doesn't mean you're going to pay for anything. You're an NHS patient, but you could get your care here. So if people want to find out more, they can contact this hospital direct on their website. And you can talk to somebody, make your booking, provided you've got that referral from your healthcare provider.
And which hospital, once again, is it we're looking for?
So this is called the Practice Plus Group Hospital in Somerset Road in Edgbaston.
So you have a good time touring the facilities. We look forward to hopefully you'll see cake as well as ribbon cutting as we go through the day. Dr. Hilary Jones, always a pleasure to speak to you. Thank you for joining us.
Thank you. You take care now.